And we're up.
What's up, Naki?
What's up?
Season 3, episode 1, our first show of 2022, and we're starting it off with a bang. We've got a Q&A session with 3 Pacific Islander doctors. How lucky are we, and how lucky is our community to get the answers from people that look like them? So, as always, KOVIKI Talk is the multi-episode series where we talk about all things COVID, and we do it in a timely fashion. So when it was time to vote, we talked about getting to the polls safely. When it was time to get tested and get the vaccine, we were timely with that information. And right now, I think the best thing to do was to get some information out there, because there's so many questions about the variant, about the surge, about all of these kind of things. And we were kind of talking about it before the show started. The best place to get your healthcare information is from doctors and healthcare officials, not the comment section in social media. So that's what we're here for today, is to share some accurate and timely information from Pacific Islander doctors. So, Naki, why don't you, or I will introduce our first doctor, is Dr. KOVIKI, an MD born in Honolulu, Hawaii, who's of Hawaiian, Maori, Chinese, and Portuguese descent, raised primarily in Layton, Utah, graduated from BYU, Hawaii in 2003 with a BS in mathematics and a minor in biochemistry, and from University of Utah School of Medicine with an MD in 2008. Completed residency in internal medicine and pediatrics in 2012 at Loma Linda University in Loma Linda, California. Practiced as a pediatric hospitalist for Intermountain Healthcare for 8 years, and now is an outpatient clinic caring for adults and children at BYU in Provo, Utah. KOVIKI mentors several medical students and pre-med students, currently as an advisor for the Pacific Island Medical Student Association at the University of Utah, and as a mentor at BYU. Welcome, KOVIKI.
Hi, thank you for having me.
Yay. Next, Dr. Malik Fuemono Md was born in California, but was raised in Samoa, where he attended school in Apia. He received and accepted a scholarship to Auckland University and graduated with a Bachelor in Science, majoring in biology. He pursued his medical school degree from St. George's University and established his residency in internal medicine from St. Michael's Hospital, Seton Hall University in New Jersey. He currently is the Associate Chief Hospitalist at Skagit Valley Hospital in Mount Vernon, Washington. He also serves as an adjunct clinic professor for Pacific Northwest Medical School, Yakima, Washington, and is a core clinical faculty for internal medicine residency at Skagit Valley Hospital. He currently lives with his wife, Tusi, and 4 kids in Mount Vernon, Washington. He enjoys volunteering time to help kids and giving educational sessions concerning the medical concerns of our Pacific Islander communities in Washington State. He also enjoys playing rugby in his spare time. Welcome, Dr. Fuimaono.
Welcome, Thank you for having me.
And also with us this evening is Dr. Sheldon Ricklin. Dr. Sheldon Ricklin is a Marshallese family physician who joined the UAMS Northwest faculty in August 2016. He's an associate professor in the Department of Family and Preventive Medicine, a co-investigator in the Office of Community Health and Research, and the medical director for the Center for Pacific Islander Health at the University of Arkansas for Medical Sciences Northwest Campus. He is the inaugural recipient of the Peter O. Kohler MD Endowed Chair in Health Disparities. He served as a primary care physician at a community clinic in Springdale that serves a large patient population of Marshallese and underserved populations in Northwest Arkansas. He's also an active member of the Marshallese COVID-19 Task Force in Arkansas. Welcome, Dr. Riklon.
Yeah, well, everyone. Very nice to meet you. Very nice to be here tonight.
Always nice to share space with what we have always at PBD. We've chased around positive Pacific Islander role models, and do we have them on today. So we know you're busy, and we want to definitely respect the time. And I think that, right now we're just trying to answer questions that are out there. And we joked about it in the pre-show about not getting your healthcare medicine advice direction from social media or from the comments section in social media or any of those things. So it's important that we get people out there timely and correct information. And it's even more important that it comes from people that look like them, talk like them, and have, gone through some of the things that they're going through. So we thank you for joining us. I'm going to turn it over to Naki, and she can jump into our questions.
Yeah, we're going to jump right in. So, Dr. Al and Dr. Ricklin, are we in a surge?
Yes.
Yeah, right.
Yeah, currently, I mean, at the height of the pandemic before last year, we were testing about 15 to 20% positive, and currently we're testing more than 50% positive, and this includes just exposures and people with symptoms. So we're definitely in a surge right now.
Yeah, and why do you think the surge is happening now? Either or, Dr. Ricklin.
The Omicron variant. It's really infectious.
And right after the holidays, right?
Yeah.
Do you think it has a lot to do with the holidays, or just this variant is so contagious?
Well, they already started surging back east before the holidays, but I don't think the holidays helped very much.
Right.
I'm echoing. Sorry.
So do you see, Drs. Au and Dr. Riklon, do you see this as kind of a culmination of Omicron is here, it's the winter, it's time that people socialize. Is it a combination of things, or is it more the Omicron, the type of variant that it is? So is it an accumulation of all these things put together, or is it more one factor than the other?
I think it's definitely a combination of the different factors that you mentioned. I think at one point, last year, amazing that it's 2020 now, but last year, we've gone through 2 years of a pandemic, and many people, including myself and others that I know, were just pandemic tired, right? And it's easy to try to follow the guidelines and tell them to follow the guidelines, but at the same time, people were starting to kind of get out there at the same time. When we saw many of the numbers started to get better. And then now with the surge that's happening now in Arkansas, it's just crazy. I think in 2020, when our first surge, we were through like 4,000 plus cases, was the highest in a single day. Now it's up to like 8,000 plus just the other day of new cases. And then of course, because it's winter time, we like to be indoors, not too much ventilation, and because the Omicron variant is also supposed to be milder, quote unquote, that many people may not have symptoms, that they're also gathering together, and of course, we're around family members as well too. So there's a combination of all those different things.
And is it contagious, or is it not? Like everyone's saying, the Omicron is not. The symptoms are not that bad. Are you finding that to be true, Dr. Malik, in the hospitals? Like, are the hospitals experiencing an increase in admission in ICU because of this?
Yeah, and just to remind people, though, I'm inside the hospital. I'm a hospitalist. So when you come to the emergency room and you get admitted to the hospital, they call me to come and admit you, though. So, this pandemic has been ongoing for last couple of months. So it's not new that we're seeing all this, though. As everybody's following the graphic, kind of goes up, goes down. So kind of back in August, we saw the Delta going up and then coming down. But then definitely we're seeing the Omicron, though. When it came out of South Africa, there were lockdowns and people were really concerning about this new variant, though. So we knew that there's going to be a surge, though. We've never seen this, at least if you look at the graph, though, the graph is going straight up like this, right? Which is kind of not surprising because they identified that the Omicron variant replicates every 2 days, though. So it kind of goes up like that, though. So we're really seeing that right now, though. So to the point where it's overwhelming our hospital system, right? So in our hospital where I work at, there's only 131 beds, though, right? We cannot go beyond that number though. So when we saw again, it's a combination of a lot of bad things. Like
Mhm.
Dr. Riklon was saying, it was winter, people were gathering over the holidays. We kind of knew that this was going to happen, though. But what a lot of people didn't think was that they keep hearing, oh, people don't get sick, though. But they weren't clear on who was not sick, though. I mean, they were not distinguishing people who were vaccinated and people who were vaccinated.
Mhm.
I feel like if you were vaccinated, you're the ones who, if you do get the Omicron, you have milder symptoms. We identify a lot of the symptoms associated with the Omicron variant is mostly up in the upper airways, where people have sore throat, they have
Mhm.
coughing, and through studies though they actually show that it doesn't replicate down in deep within the lung tissue, so mostly up in the airway. So a lot of people have symptoms that is kind of mimicking a lot of the other upper respiratory symptoms. Mind you though, this is cold weather, right? We're in the flu season. There's a lot
Mhm.
of viruses floating around as well. So it's a combination of a lot of bad things though. What I have to say is that we're in capacity right now. I don't know about the other states though, but Washington is really close to triggering the crisis status, to the point where we're going to lock down everything.
Mhm.
Right? We're seeing this in the last week. In fact, a lot of association of hospitals in the state of Washington have written a note to Governor Inslee to initiate this crisis now. So last year, Idaho, Alaska did this. Now Washington, because of the surge that we're seeing right now, we are at capacity. We are trying to send people out. We are trying to get people in. But what we're seeing though, and I think this is something that a lot of people didn't anticipate, is that the nurses or the doctors are now sick now because of how contagious the virus is. In fact, one of my providers called last night and said, my wife was positive. I cannot come in though. I'm exposed though. So a lot of our nurses since last week or last 2 weeks, a lot of them had called in sick, and then there was an outbreak of COVID in a wing in our hospital. So what we're seeing is, again, a combination of a lot of bad things though. We're short staffed, we're short nurses, we're short doctors, we're short respiratory therapists. There's not enough room. So it's really, really bad though. That this is something that I'm glad you guys are talking to me, because I need to spread the word that people need to get out there and get vaccinated. There's a lot of concern that the kids are now involved as well, especially the kids less than 5 who are not yet vaccinated. That this variant, though, even though the media is portraying, oh, it's very contagious, but not as sick, though. But we're seeing a lot of unvaccinated people. I would say 99% of the patients in the hospital are not vaccinated. In
Mhm.
fact, one of my patients who I admitted earlier today was a 39-year-old gentleman who wasn't being vaccinated. So it's very concerning, especially for our people, though, because you're the ones that, since the COVID started, we identified that our people are the one dying from the COVID. In
Right.
fact, though, I talked to Joseph Seia a few days ago, and 4 Samoans died. One was a 30-year-old woman with no medical problems.
Mhm.
So again, don't let the media say this is nothing serious. There are still people dying. There are still people sick in the hospital. And we need to get the message out there for our people to get vaccinated. If you need to be on a booster, go out and get your booster. And if you're still not vaccinated yet, I would still advise a lot of people to go out there and get vaccinated. It's really, really bad in the hospital. There's no words to explain what's going on.
Is that, I remember early on the discussion was what can the infrastructure hold, right? So how many bed, there was the bed counts, and there was the, our hospitals at capacity, um, because of the lack of treatment with COVID. Is that because the numbers are so much higher now than they were, at the previous peak, I guess is how I would put it. Um, is that what you're talking about? Is that is again a concern? Is that we could flood our healthcare capacities and then not be able to reach people that actually need the treatment? Is what we're saying again at this point?
Yeah, that is what we're saying though. What I've seen happening too is that people are flooding the emergency room to get their test as well. As you guys are well know, no, it's very difficult to find somewhere to get a test, so people are deciding to come to the emergency room.
I've seen that.
And that's not the place to go get a test, though.
Right.
Again, a lot of fronts, though, we our safety system that was supposed to be in check is not in check right now. I think there's a lot of confusion with the CDC guidelines. Now it's saying 5 days, and people are still questioning the COVID vaccination. So it's really, really a combination of a lot of bad things, though. So, but just to tell everybody, though, do not go to the emergency room unless you're very sick, though. Right? It's very important, but otherwise you'll be spending hours and hours in the waiting room, and there's really no room inside the hospital. If you let's save the room in the hospital for those people who are really sick, though.
Yeah, waiting in the ER is a good way to get sick if you're not already really sick.
I was just
Please
thinking
don't
that,
go there.
like, if you didn't have it before you went in, if you're trying to get tested, I'm guessing that you definitely will have it if you leave, if you're waiting around to get
Yeah,
tested.
this variant is very contagious, though. I mean, if one patient has it, the neighbor who was a few feet away from that guy is going to get it.
Right.
It penetrates a lot of the regular masks. So in fact, though, the recommendation for everybody in the hospital were N95, though. We used to kind of reserve those for patients who have it, and now the recommendation is we need to count up and make sure that we protect ourselves. So.
Yeah, I was looking at the data earlier today, the epidemiologist at Texas, University of Texas.
Yeah.
So hospitalizations in the past 2 weeks have increased by 78%. We broke the pandemic record yesterday with 135,292 hospitalizations. The previous peak was 132,474. So highest since the pandemic started. So yeah, even though it's not as serious as far as symptoms go, we are going to overwhelm the system. And today, 2 of our providers in clinic tested positive. So we're down 2 providers and 2 MAs in clinic as well.
Jeez. So what should you suggest if someone is feeling ill? What should they do to take care of themselves instead of going to the ER if they're not sure whether or not they got COVID? They're just sick. You can't find a test because we can't find a test anywhere here either. How should they take care of themselves at home?
I would recommending treating themselves as if they're positive. I know the tests are very limited. So isolate, right? Meaning you stay away from your other family members, make sure you hydrate yourself, and wash your hands, kind of like what we've been saying in the beginning, right? Washing, distancing, and washing your hands and wearing masks, though. I would say that, though. I mean, if you do get a test, though, please get it, though, because it's very important, though, to know if you do have the virus or not. Because a lot of us, though, if we get the virus, then we tested positive, our behavior really, really changes. Now we take it seriously. But I think for now with the Omicron, it's safe to say that everybody has it. If you have a symptoms, let's just say you have it until your test is negative, then you back off. I think it's very important for us to kind of protect our elderly members in our family, especially our kids, though, especially the one who are less than 5 because they haven't been vaccinated yet, to make sure that it's up to us. If you do have those symptoms, to make sure that we isolate from our family members, though. I know about the other panel members if they have anything to add to that, but please take it seriously.
Dr. Samoa has asked, when should someone be concerned and how sick should they be? I think as outpatient doctors, we're kind of trying to keep people out of the ER. So if you can get into your outpatient doctor, I would recommend that. If they are full, go to your urgent care. I think symptoms that you should watch for are, the main things are shortness of breath, difficulty breathing, and dehydration, which with this virus I don't think is going to be as common, but I think mostly shortness of breath is when you need to worry, and weakness, go into urgent care. If you're really short of breath, go to the emergency department. Do you guys agree? Anything to add? Oh, go ahead.
My son has asthma, and he has respiratory, chronic respiratory problems. He's always had asthma, and he had a slight respiratory issue, and my wife does not play with that. She sent him to go get tested. He tested positive, and we locked him in a room, but it was that little what's different about that? Is there a respiratory issue? And go get tested, because it would have been easy to just And when you're 23 or 22 or 23 or whatever, everything's okay, right? If you ask a 23 or if you ask a young person if they're okay, they're probably just going to say, "Yeah, I'm good." I'm okay. So I think having a heightened awareness, especially with people that already have things like asthma or other things where they may just shake that off as like, I've been dealing with this kind of thing my entire life. I had a question about Paxlovid, the COVID-19 pill. Is that a treatment after, or is it a preventive measure? What is Paxlovid?
So this is the one from Pfizer, though, the same company that had the vaccine. So it's an antiviral. My understanding is that it has a place in preventing people from coming to me, though. Right, Dr. Riklon? It's kind of like Tamiflu that we use for the flu. What it is it prevents the days of sickness, though, from if you're sick, though, then you're sick for a less amount of days than if you didn't get the treatment. Um, I know that the federal government bought millions of doses, though, but as far as locally where I'm at, our infectious disease doctors say it won't be available until late February. But it has a role in preventing people from coming inside the hospital. But it's very great drugs, though. I feel like it's more than 80%. It prevents people from getting worse. There's another antiviral, the Molnupiravir, Monopiravir. That's the other one. It seems to be available right now, but it's less effective, though. It's only 30% prevention of people getting sick. So these are, like I said, the pandemic has been around for a while, though. So we have other tools and ways to kind of manage this virus, though. But the message is, though, these medications are available to prevent you from having symptoms. But again, it does not replace the vaccination, though. If you get the vaccine, you won't get sick. And number two, you won't come back to me, though, in the hospital. So those medications are very important. They're there. It has a way of kind of preventing people from coming inside the hospital. But again, we're talking about months ahead, though, right? By the time they're available, who knows? We might have another variant, and we need to kind of rethink our strategies again. So
And I think that's where it's sorry, Dr. Malik.
I just want to add, there's monoclonal antibodies as well. That's what we give if you come to the emergency room and then send you home. It prevents you from getting sicker as well. So there are a lot of different medications here, but again, it does not replace the vaccine. Go ahead, Dr. Ricklin.
Agree with Dr. Malik. I mean, even though he's a totally nice guy, you try to prevent yourself from seeing him at the hospital, right? That's what we're trying to get our folks to stay healthy. Don't go to Dr. Malik in the hospital. So we're trying to, keep you healthy. So definitely we have those armaments, we have those tools with, with the oral antivirals that he had mentioned, with the monoclonal antibodies, and things are changing all the time. We're still learning things, as far as what's working for what monoclonal antibody is working for the Delta versus the Omicron variant, and what's working may not be working with the other one. So, but at least we know that those things are there in terms of treatment. But like Dr. Malik said, with the vaccines, that's supposed to be a public health preventive measures, right? So you try to give it to people, so hopefully they don't catch it. But if you do catch the virus, then at least you're not as sick enough that you need to go see Dr. Malik in the hospital. Okay, so that you can actually take care of yourself, stay at home, follow the guidelines, take care of yourself and the family at home.
Okay. And what should parents do? I'm sorry, go ahead. I was going to ask, what should parents do for kids that catch COVID that haven't been vaccinated, like 5 and under? Should they, of course, they're going to keep them home, but should they treat them? How should they treat their kids if they test positive at home?
So if they have underlying conditions, you should speak with their pediatrician, see if they need any other treatment. But otherwise, isolate them, keep them hydrated, ibuprofen and Tylenol for pain to make sure with the sore throat that they're still drinking well, and watch them for signs of shortness of breath. So we call it like tracheal tugging. If you see right here going in, if they can't speak in full sentences, if you can see in between their ribs or underneath their ribs is really sucking in, you need to take them in to the emergency room.
good to get nice, clear direction of
Right.
what to look for and from a doctor. So 2 points I want to make here real quick. One, you are talking to the Healing Association of Pacifica Islander doctors, the HAPI doctors. Leave questions for the doctors in the chat if you're watching this show live. However, the majority of our viewers watch this show after, so they're going to see this later in the week. When they have time to see it, they're going to click on the video and they're going to watch this. If you're watching this and it's not live, we have an e-community health worker that is monitoring the video, so you can still leave questions in the chat, and the e-community health worker is going to find the answer to those questions. So if you're watching this and it's on social media, you can ask questions, and the e-community health worker will find the questions, and you can leave your email, or you can email us at healthquestion@polybydesign.com, and we can get you connected or get the information that you need. So if you're not watching live, you can still ask questions and get that information or those resources. So I'm going to read a question that I got to read, and I'll preface this with, I have no idea what I'm asking, but I'm sure the doctors will understand it. When do you use the monoclonal antibodies for COVID-19 pre-exposure prophylaxis? I have no idea what I just said, but I'm sure that you do.
Can you repeat that again, Carl?
When do you use the monoclonal antibodies for COVID-19 pre-exposure prophylaxis?
Oh, I think he just said.
So that's for severe immunocompromising conditions, is what I've read about it. I've never had to use it, but whenever someone has COVID and has an immunocompromising disease, I'll look up the guidelines and risk stratify them and decide if they need it. If we have any questions, we can always call the health department or our local infectious disease doctor. But yeah, so far it's moderate to severe immunocompromising conditions.
So it's an antibody that you inject in somebody's body that will help them fight the disease. Is that what it is?
Yep.
Yeah, because people with immunocompromising conditions, they can't mount a response to the vaccination, and so giving them antibodies in this way would be a way to help them to fight the infection should they get it. But they really need to be careful, and the people around them really need to be careful to avoid infection.
Right.
Naki, you sounded like a nurse asking that question. That was perfect.
I know, right? Because I hang around with you guys all the time, but I really need it broken down into, simple.
So the monoclonal antibodies, though, it's an IV infusion, right? So it's not a pill or tablet that people take, though. So I don't know. I think different states have different strategies. At least in the state of Washington, you go to the emergency room with mild symptoms, and before they send you home, they will give you a dose of this monoclonal antibody and then send you home. But it's usually under the guidance of, like Dr. Au was saying, infectious disease doctors. Those are the ones who kind of limit that. Just to let you know, if you come to Skagit Valley Hospital, we ran out of antibodies. We don't have it anymore.
Oh, wow.
Yeah, it's already given. Right now, we're just waiting for a new batch of them.
Uh-huh.
So it's something that we've been giving for patients with mild symptoms and high risk to prevent them from coming inside the hospital. So again, like any resources, eventually it will run out, though.
Yeah.
Wow.
But your question was about pre-exposed, like for someone who doesn't have symptoms and before they get exposed, right?
Right.
Yeah, that was the question.
Right. So is that usually used for like cancer patients, that elderly? Would you use it for, is that what you mean by like?
Yeah, those are the high risk patients that get those, though. If you're young, though, and asymptomatic, we just send you home with no treatment. But it's usually reserved for those people who have comorbid conditions that make them high risk, though.
Okay, got it.
Yeah, like somebody who had like a liver transplant or kidney transplant, or anybody that's immunocompromised, like taking immunosuppressive therapies and such like that. So those are the ones that usually qualify for that kind of therapy.
Okay. And so I'm vaccinated. I'm waiting to get my booster. Should everyone follow through with the booster, and why?
Mm-hmm.
I'm just waiting because I'm not against it. I'm just waiting.
I can tell you, man, I think So far, I mean, because I think everybody's scared of the different variants, that's
Mhm.
coming in with the Delta and Omicron. And we know that the boosted folks are the ones who actually are much more protected than even those who actually get the preliminary series. So it's always good to get the boosted dose if you qualify for it, right?
Mhm.
Okay, so let's say if you had the Pfizer vaccine, then basically they shorten the time period, right? That you basically, if you have 5 months since your second dose of the Pfizer, then you can get your boosted dose. Okay, so it's again the data as these data come in and the studies come in, this recommendation change. So it's even us doctors, we're trying to stay on top of these different kind of
Right.
recommendations always come in, and we have to try to interpret it to our folks, and of course with our folks who are not English speaking folks, we have to kind of explain it even more into simpler terms.
You
You
had
want
talked
to
about,
think of it. Oh, go ahead.
no,
Go, go.
absolutely. Go ahead, Dr. Al.
You want to think of it in really simple terms. Like if you get the virus and you're not boosted, meaning like you don't have as many antibodies, that virus has time to replicate and multiply really quickly while your immune system is working on building antibodies. And by the time you've built antibodies, your viral load will be much higher and you're more likely to have more symptoms. Whereas if you have the booster and those antibodies are already there, they're ready to fight already. And that virus doesn't have as much time to replicate and amplify. Does that make sense?
Yes.
Yeah.
Yes.
I love the
Yeah.
explanations. I
I
love
know. I'm
the
like,
just
bells are going off.
right.
Well,
And
this came about though because they actually, like I said though, even though people were given vaccine though, they were still studied, right? So when
Mhm.
the first people who got the vaccine, they followed them out months after the initial dose, and they realized that the antibodies were coming down. I think in Israel, that was the first country that got the Pfizer. They're getting their fourth, I guess it's getting the second booster now. So they're the ones who are kind of like following the science, right? We look at other countries who got the vaccine before the US and then base our recommendation on that. So at some point, though, as we seeing these different variants and having mutations within the virus itself, though, we
Mhm.
might need to change our vaccine. Though I know Pfizer is already working on a vaccine specifically for the Omicron right now because of how fast it's going. But there's a lack between when we have the real science and looking at what we're seeing right now. So what we're saying is that we follow the science. There are going to be more recommendations coming through as long as we're seeing all these new variants. There's the new one in France, the IHU. I don't know how you
Mhm.
pronounce that, but here's what's going on, right? The U.S. took the vaccine, all right? The rest of the country didn't get any vaccine, so the virus was replicating in other countries, though. What we were seeing is not new variants coming from the US, though, because we're all vaccinated. So because we kind of contain the virus, though. The rest of the world, though, didn't get the Pfizer, didn't get the Moderna. They
Mm.
have like other vaccines, though, that were not effective. So meanwhile, it keeps replicating in all these countries, though. But guess what, though? We're not in a silo, though. People travel, right? So now with the South Africa bringing us the Omicron, now France is bringing another one. We're going to see more and more of this unless we all have like send vaccine to other countries. Though I mean, thank God I know some American Samoa is fully vaccinated, maybe 80%. They
Okay.
haven't had any cases on the island because it's on lockdown. I'm pretty sure there's other. I'm pretty sure Marshall Islands and other countries are trying to protect their populations by making sure the vaccination is. But as long as other countries are not getting vaccinated, this is not going to be the end of the variant. We're
Right.
hopefully that it will keep mutating into a less severe variant, kind of like the flu, right? We get the flu every year now. Now I suspect though that at some point the COVID-19 is going to be a regular coronavirus like the cold though.
Mhm.
But we're not there yet though. It's still killing a lot of people though. But again, it requires us to be more vigilant. Simple thing as washing your hands, social distancing if you're sick, but then going out and get the vaccine. No, these are the ways we could end this pandemic. And I can't stress that enough though. But again, meanwhile though, our healthcare system are stressed out. So we need to kind of you people who are listening need to help us by making sure that you do what you need. It's all up to us to kind of get to do our thing to end this pandemic. So
you get the booster, you're less likely to see Dr. Malik. That's a good
Yeah.
thing. We have a
Exactly.
question on Facebook from Eva Lily May Hatoa. Hello, it's so good to see all of you on PBD. I have a quick question. What is the likelihood that someone will get the COVID-19 infection twice, although it seems to be a rare phenomenon? Thanks for your help, guys.
It, before I let you guys answer, is it rare that someone gets it twice? And then I put my 2 cents in.
Well, we're talking about different variants here, right?
Right.
So the Omicron is a whole different virus than the Delta, though. So again, they're all descended from the same COVID-19, though. But as long as we get this variant, though, all of us will get it, though. So there's even, and I need to stress out too, though, that there are breakthrough infections, though. Nobody said when we did the vaccine, though, that there were going to be 0 people getting the vaccine. So let's not get that confused, though, that people who get the vaccine will not ever get sick, though. We still need to do the masking. We still need to do everything we need to do from the from recommendation from the CDC. But you can get twice, 3 times, or 4 times the COVID, though, if you're not following along the guidelines, though. I don't know about the other panelists, though, but I feel like we're still going to get infected as long as people are out there not vaccinated, not masking up, though. You just
I'm
asked.
absolutely agree with Dr. Malik. I know of people, and I apologize for jumping in there, Dr. Malik. But patients of mine and families of mine that have gotten infected twice, and I think part of it again is with this different variants, and I think that's where the message is that we need to tell our folks was as long as it's alive in the community and is passing easily between community members, you're going to get new variants that are going to come out. And who knows, there might be new variants that are even more contagious than the Omicron or even the Delta, and maybe even more lethal than they are. So, for us to put a stop to it, we need to stop the transmission. How do we do that? We need to get folks to get vaccinated. And just to, since I talked a little bit more about the booster shot for Pfizer earlier, so for the different vaccines, for Pfizer, you can get it as young as 5 and up. And then the booster will be from 12 and up, right? And
Yep.
that's supposed to be 5 months after your second shot. For the Moderna vaccine, anyone 18 and above can get it. Those 18 and above can get the booster shot 6 months after. I think they're trying to apply for an earlier time period to get it done, similar to what the Pfizer is. And then, of course, the Johnson & Johnson, which is usually just a one-time dose. You're supposed to get your booster shot 2 months from your one-time dose of your Johnson & Johnson as far as the booster. So I think, as long as you get boosted, we know that those folks who are getting the booster shot are doing much better than others who are not.
I know our time is limited with Dr. Owl, so I wanted to ask one question of all of you, but I'm going to let Dr. Owl go first. What would you say to, the people, because there are people out there that feel like, hey, it's been around for a couple of years. A lot of people have had it. A lot of people are vaccinated. Maybe they feel like they're reaching herd immunity. So the thought is like, why do I need to get vaccinated now when so many people have had it and so many people are vaccinated? What would you say to a person with that thought?
I would say, look at the numbers. The hospitalizations are at the highest they've ever been. We don't want people to get hospitalized. I used to be a hospitalist. I don't enjoy people being sick enough to be hospitalized. I want people to stay healthy. I want people to be alive, to be with their family members. So I would say, yeah, it stinks that it's been around for 2 years and a lot of us have gotten it, but the amount of people that are still getting it leads to, what we're seeing right now is higher hospitalizations, and deaths usually lag 3 to 4 weeks behind. So we haven't reached the death rate that we're expecting, the epidemiologists are predicting. So just get your vaccine. We're not back in the 1918 influenza where we didn't have anything available to prevent or fight, and we do now. So your ancestors would tell you, please take care of yourself.
Very well put. Dr. Fuimaono, would you say the same thing to the people that are, it's 2 years old. There's a bunch of vaccinated people out there. There's a bunch of people that already had it. Would you say anything different than Dr. Ao has?
Yeah, I would say though that a lot of people don't really pay attention until it's their loved one. That all of a sudden no COVID is in their houses and now like wow. One of the saddest thing I've heard people in the hospital, right, who have COVID, who passed away, telling us, like the nurses and the doctors, like, I wish I could turn back time. I would have got the vaccine, right? That is the reason why I take my time to come and talk to you people right now. I mean, we try to treat people in the hospital, but the chances of you walking out, though, it's not really a high number, right? A lot of people who send their loved ones here though don't end up walking outside the hospital. So we in the hospital trying to save as many people as we can, but it's real limited though. We only have a few medications though that are not as effective as the vaccine. And I always say this though: if I could convince one or two people to go and get the vaccine, I feel like I've done more to contribute to the pandemic than trying to save somebody in here. Right? It's already too late though. I mean, to prevent people from coming, first of all, inside the emergency room to the hospital is a win though for me. So I would again, advise people to wash their hands, mask up. It's not hard though. I mean, your part is it's very straightforward though. But again, a lot of people are not paying attention though. And I don't wish it on anybody and their family though. I mean, now it's involving kids now, so the game has changed though. Last year it was always like, oh yeah, it's older people, older people. If you have kids though, and any one of your kids end up losing their life because of this pandemic, then it's all for nothing though. I mean, a lot of people care for their kids. They care for their family, their inga, their ohanas. I mean, a lot of us, we don't want to go to those funerals though. So again, I always advise people to follow this advice. Prevention is better than cure though. I mean, cure is not 100% though. Preventing you from getting sick though with the vaccine, that's real science right there.
Right.
So again, go out there, get the vaccine. It's never too late. Uh, a lot of our people feel like, oh, I feel bad. They're gonna make fun of me and all that. Well, we islanders are like that though. So I know my people, right? They're like, oh, I feel like they're gonna say some bad things to me. It's worth your life. It's worth your family's life to take that chance, right? Don't listen to what's out there. Come and listen to KOVIKI talk. Send us your question. We will answer them.
Yes.
I think like we earn the right to answer those questions. We've been in training and we know the science. So at least people come and trust us though. Whatever question you have, go out there, get your vaccine, and we'll be happy to answer all your questions. Thank you.
Awesome.
Thank you, Doctor. Dr. Riklon, I feel smarter after I get off these shows with these really smart people. Dr. Riklon, what are your thoughts on the people that think they don't, at this point, it's late in the game and I haven't got the vaccine and I haven't caught it, then I'm probably okay. I don't need to do it. What would you say to those people?
I mean, just piggyback on, what the other two panelists have mentioned, and totally agree with both of them. And again, I don't think it's too late. I don't think it's too late for you to get your vaccine. I mean, if you really love that person next to you, if you really love your family, if you really want to go back and do what we normally do before this pandemic and enjoy festivities and island ways of spending time with families and going and do the parties and going and sing songs in the churches and all those things that, we islanders love to do as a group. Because, for us islanders, it's all about the family, right? It's all about the family and taking care of them. And for us to be in this pandemic for 2 years plus, I mean, it's so un-islander, unlike us. We're supposed to be together and enjoying all those things. And, some of us are finding ways to do that. But, sometimes we put ourselves at risk. And the best way to kind of follow and get this pandemic out of this way and keep ourselves safe at the same time, our families and our community, is to follow those guidelines that we've been always been talking about, with washing hands, masking up,
Mm.
simple things, and social distancing, and of course getting vaccinated. I mean, us Pacific Islander doctors wouldn't tell you to get vaccinated if we didn't think it was good for you and the family. I mean,
Right.
we Pacific Islanders, we don't tell people to do things to hurt themselves. We tell you to take care of yourself so we can get together again as big, happy family of Pacific Islanders. So it's not too late. Get vaccinated, please.
And I have to head to another meeting, but nice to be
Yeah.
with you guys again. Thank you.
Thank you, Dr.
Dr.
Al.
Al. We appreciate it.
Now,
No, thank you.
Okay. So if you end up getting COVID and you get to the hospital and the person doesn't speak English, and how would they get help? Like if someone came in and couldn't speak English and was a Pacific Islander, is there some resources at the local that person
Yeah,
get information in their own language?
yeah. So if you ever end up at Skagit Valley Hospital, ask for me. I will come in fluent Samoan, right? There's some Marshallese here, Dr. Riklon. I know there's translators available in a day, but we do have a stick though. It's an iPad where we have all the languages though. I know it's a mandate from the state of Washington to have a translator available to anybody who comes inside the hospital. So there are resources though. Ask for it though. I know my people, they're ashamed though. They're like, yeah, I know English, whereas in fact though, they have no idea what's said though, right? So that's the reason why I volunteered to kind of go and help like Samoan family in the state of Washington with translating a lot of the medical lingo because they don't understand what's going on. Again, you can understand English, but we all know like the language we speak as doctors is a whole different language though, even though you can speak English really well. I'm pretty sure Dr. Riklon understands that as well. But again, I urge people though is either I know there's in state of Washington there's BICA, there's a lot of associations in different state. I know in California, I know in Utah, there's associations involved in trying to help people get the resources. So ask around though. I would say though that in any hospital you go to, let them know that you need a translator first of all, and then they will provide that resources. It's very important to know what's going on though through a translator because I know there's a lot of culture set differences.
Right.
There are some things that people understand and people don't understand. So you really need a good translator to understand what the doctor is explaining to you guys.
Mhm.
But again, I'm pretty sure there's a lot of resources available. I know in the state of Washington, there's a lot of Samoan speaking. I know for a fact though, that there are translators available in a lot of hospitals down in Tacoma, Seattle area. But regardless of where our people are, though, ask for help, though. People don't know what to get you unless you ask them specifically for help. Let them know you have trouble understanding English. Or you can tell them, Dr. Fuimaono on a podcast said, if I get sick, though, I need a translator. Hey, say it to them. They will get it, right? Don't be
Right.
shy. I mean, our people are like, oh, they'll make fun of me. Ask them, right? If you're sick, it means you're really sick, though. You need the help that you need and ask for that. So,
Right.
I'm
Thank
going to
you.
ask for you, even though I don't speak Samoan. But I just want to piggyback on what you mentioned. I mean, I think nowadays things are very different, right?
mhm.
I think before not much was known. We were more invisible before pre-pandemic. I
Yeah.
think people now know more of who the Native and Pacific Islanders are, right? Because we've made the news so many times, unfortunately for bad things, unfortunately for bad numbers in terms of being disproportionately affected by this pandemic in terms of
Mhm.
hospitalizations, illnesses, ICUs, and deaths especially, even though we make a small percentage. So there are definitely some resources in the different places that we are at. You know, at least in Arkansas, I can tell you most of the Pacific Islanders here are Marshallese. Majority of them are Marshallese, and we've made headway in making connections with the clinics and with the hospitals and with the universities and you name it. So when you go into the hospital, if you tell them you're Marshallese, they will find a way to connect you. And we even made sure that some of the grants that we were able to get in from the feds or from other places were used towards that in getting bilingual contact tracers or bilingual navigators, bilingual interpreters, CHWs, or whatever you want to call them. And that's been amazing to kind of see, at least here in Arkansas. So I know I'm talking about Arkansas, but I know things are also happening in Washington and Oregon and California and Iowa, and I mean, you name it. So we're not as less known as before. We're starting to come out and people are starting to notice who we are. So ask for it. 'Cause it is your right. You know, you need to have a person talk to you so you make that informed decision for your health care. And each hospital is responsible to make sure that you understand what you're getting. You understand why you're getting admitted to Dr. Malik, why you don't have to be admitted. You understand what decisions you're making. I mean, it's your right as a patient. As you read your patient rights in the hospital, so the clinic says the same thing. So you have the right to understand what they're talking about because, as mentioned earlier, I mean, it's translating English into Samoan or Marshallese and then translating it to medical jargon. Oh my goodness, that's craziness.
It is craziness.
I think
When
if you're watching the show and you don't live in Skagit Valley or in Arkansas and you need a translator or you need support or you have questions, you can email us at healthquestion@polybydesign.com, or leave comments on the video and our health worker will reach out to you and get you the information that you need. So again, if you're watching this after the live show and it's not Monday at 5 o'clock in Pacific time, leave the comments or the questions or send us a email at healthquestion@polybydesign.com and we can get back to you. Go ahead, Naki. Sorry about that.
That's okay. So with the day change, when you get COVID, how many days should you quarantine? It was 10, and it was 5, and what is it now?
I believe it's 5 right now. So there's a lot of controversy around it. But as it stands, the CDC, if you check their website, it says 5 days. But there's a caveat there, though, because you have to do some testing after the 5 days. If you're still positive, then you have to isolate for 10 days. If you're negative and still having symptoms, they're recommending wearing masks for the rest of your isolation and for 10 days. So as it stands, it's 5 days right now.
5 days, and if you test positive after 5 days, then you go another 10 days?
Yeah. 10
Wow.
days.
Yeah, so and I think that's where what I'm talking about earlier in terms of the science and all these studies that keep coming up and it changes, but it's still with all the changes, it does kind of confuse you at times as far as exactly what is right. Because you're right, it was 14, then 10, then now 5. But if I think there is some categories in terms of if you're vaccinated versus if you're not vaccinated, you have symptoms versus you don't have any symptoms, but if you do a positive test, then you're supposed to isolate for 5 days and then continue to wear your mask. You can get up isolation, but continue to wear your mask, strictly mask wearing for another 5 days. Okay. But if you have no symptoms, you've been fully vaccinated, you're not supposed to need to quarantine, but it's recommended you get tested after 5 days to double check. But at any point you have any symptoms, then you definitely need to get tested and double check on your status.
Awesome. Thank you, Dr. Riklon.
We have a question in the chat from Facebook, Matthew Leota. Hello, everyone. If vaccinated but not boosted, how long should one wait to get boosted after having the Omicron variant? So I guess this is a person that's been had the initial shot, hasn't got, have been fully vaccinated but not boosted, and then after having the Omicron variant, would they wait to get the booster?
I think Dr. Rickline, you went over it earlier, but can you repeat that again? After the Moderna, after the Pfizer, after the Johnson?
Well, this one is a little bit, throws a little bit of a curve to it because he's talking about you got the 2 doses, but then you got the infection after that.
Oh, the
And then when are
infection.
you supposed to wait to get the booster shot?
What's vaccinated? How long should?
Right. So if you didn't have the Omicron, you didn't catch it, you didn't become
Mm-hmm.
Mhm.
positive, then it's supposed to be for Pfizer, supposed to be 5 months after second, and Moderna is supposed to be 6 months at this point after the second dose.
Right.
Mhm.
Now I'm trying to remember what the answer is to that question, because are you supposed to wait until you're, because it keeps changing. I don't know if it's 90 days after or is it immediately after. I'm not sure if Dr. Fui
Yeah, I would
knows.
recommend that he sees his primary care doctor because I feel like I don't ever want to give advice though with a piece of the story, right?
Right.
So, because I don't know if this gentleman still have symptoms. Maybe he's still in isolation. He has symptoms. So he needs to follow up with his primary care doctor. I don't know if he has any diabetes, any cancer, or anything like that. That might change the answer. So I would recommend that he goes and talks to his primary care doctor to figure out when he could get the booster.
Ah,
That
Because
makes
if you
sense
get
because the
positive
primary.
with
makes sense.
Omicron, you might also be in line for some of the treatments as well too, right? So that may also complicate the picture. So it's great advice by Dr. Fuimaono.
Yeah,
Yeah,
he
that
needs
makes
to
sense.
see his primary care doctor. Yeah.
Awesome. Thank you for that. So, what we've learned here is to make sure that we're vaccinated because that's, and if we're gonna I caught COVID for a second time. So I'm currently quarantined. So
Mhm.
that just shows I'm vaccinated. And so I have the first time I got COVID, it was bad. My lung, I should have been hospitalized. I almost, I almost died. And so this is the second time that I've caught COVID. And I really believe because I'm vaccinated, I have like I'm here talking to you, right?
Yeah.
I'm not ill like I was the very first time. And so I'm grateful that my family was vaccinated. And I feel like because we were vaccinated, we don't have the severe symptoms that some people are going through. So I think that Dr. Fuimono, I know we have um, not too much time left, but is there something that you want to get out before we leave that you feel we haven't covered?
Yeah, I still feel like the vaccine is really the key and solution to all this, though. Um, Again, I wish I could sit down with any viewers who have second thoughts about the vaccine. Though I know there's a lot of things out there that people are listening to, though. But again, like Dr. Riklon was saying, though, I have a family, I have a wife, I have kids. All of them are vaccinated who are eligible, right? I have a 4-year-old. Maybe when he turns 5, I'll get him the shot. I would not recommend that to my loved ones, though, if I don't feel like it has benefit, though, right? That the side effects are not there, and that the benefit outweighs those side effects, though. So I got it. I got my booster already. My wife is already vaccinated and got her booster late in December as well. So, and all my kids have it, though, the ones who qualify based on their age group, though. Again, the message is, though, it's very simple, though. If you haven't been vaccinated, please go out and get it. There's never a time frame there. As long as we're dealing with the pandemic, there's a chance for you to get the vaccine. Again, our people, once you get the COVID, though, there's a chance you might die. Like Naki was saying, she almost didn't make it, and we didn't have a honor to talk to her. But a lot of people don't have that luxury, though. I mean, there are some ones who died. There are Marshallese people who died. It could be our neighbor. It could be our loved ones. It's just a matter of who's next, right? If
Mhm.
we don't hinder the advice that we're giving, people always keep dying, right? So we're over 800,000 people dying in the U.S. though. That number is still going to go up to 1 million. Though it's just a matter of time now. So
Mhm.
again, people, I know there's fatigued. You guys are tired. We want to go back to normal life, but again, we need to do our part by making sure that we vaccinate each and every one of us. Because collectively, once we get that herd immunity, where more than 80% of our old populations are vaccinated, then the virus cannot harm us. Though it's going to be like the flu, though. where we at least get one vaccine every year. So to get there, please go out and get your vaccine. Again, take care of each other. Don't listen to the what's all that nonsense out there.
Mhm.
Come and get your information from KOVIKI Talk, and we'll make our point to kind of come and answer your questions.
Thank you, Dr. Fuimaono. Dr. Ricklin, real quick, there's a last question in the chat there. Someone thinks they've caught COVID and they're vaccinated and boosted. How long should they wait before they get tested? Should they get tested right away? Should you wait 3 days?
That's a great question. And, I think, the recommendation now, there's been a range. They're saying usually it's supposed to be between 3 to 5 days after your contact or your exposure. Right now, they're saying it's more like 5 days after that. But of course, if you're waiting for that day 5, but you start developing symptoms before that, get tested at that point. If you have no symptoms, then you can wait until 5 days later after your exposure to get your test.
Awesome. Thank you, Dr. Glenn. Is there anything that we haven't gone over that you want to get out there? Do you think we've covered everything, or what do you want to put out there before we let you go?
For myself, I would say, from us Pacific Islander docs, again, that's who we are. We're Pacific Islander docs. We're not politicians. We're not businessmen. We're not trying to make money. If we wanted to be billionaires, we wouldn't be in the healthcare field. We wouldn't be running for Congress and all that. But we're Pacific Islander doctors to our Pacific Islander families and community members who are listening to us. What we're telling you is coming from our heart. That's who we Pacific Islanders are, trying to encourage us to take care of each other, take care of the family, take care of the community. How do we do that? We wash our hands, we wear our mask all the time, we social distancing, get vaccinated. If you're eligible, please get vaccinated so we can get back to the normal at some point. Thank you so much.
Thank you.
I would like to end by saying that, even though we're focusing on COVID, there are other chronic conditions still out there. So I just want people to go see their primary care doctor, do your cancer screening. When we got the lockdown in early 2020, though, we were seeing a lot of patients coming in with stage 4 cancer because they miss their primary care doctor. So even though we're focusing on COVID, though, people go back and see your your primary care doctor. Watch your diabetes, make sure you take all your medications and do all your screening that you're supposed to, though. I feel like a lot of people are just, focusing on COVID, though, but then not focusing on other diseases that haven't gone anywhere. It's just the focus has been on COVID, though. So go get screened, go do your regular mammogram, do your pap smear, do your colonoscopy, do everything that we did before the COVID, though. A lot of people are neglecting that. And, again, it's the new year, trying to, cut down on the weight, though. Go for a walk. It's a new year, so let's start with some New Year resolutions, and maybe one of that New Year resolutions is finally getting that COVID shot, right?
Right. I feel like that weight thing was directed at me, Dr. Malik. I'm trying the best I can. I'm trying. But if we come to the end of the hour, it's so quick. And I know people have tons of questions. So if you have questions, go ahead and email us or send us messages through Messenger. And we'll try to get your questions answered through the doctors. We just want to thank you so much for joining us this hour. The information that you've given us I'm sure we have saved lives. And really what we're trying to do is just save our community. Pacific Islanders, the numbers have been so high in the data that we've been disaggregating. You know what I'm saying? Pacific Islanders, just our numbers are high. And so we're trying to these doctors and our community, we're trying to save your life. And I think one of the ways is to get vaccinated, like Dr. Fuimaono and Dr. Ricklin has so stated here. And so we thank you for your time. We know how crazy busy you guys are. We're going to let you go this hour. This hour was brought to you by, of course, NAOPO, National Association of Pacifica Associations. We're grateful for this time. We're grateful for you. We'll be here in 2 weeks. KOVIKI Talk will be back in 2 weeks. We'll be answering your questions as soon as we can. So thank you so much. We appreciate the time that you guys have given us. Carl, anything before we go?
No, thank you, doctors, for your time. We know how busy you are, and to carve an hour out for us, we really appreciate it, and the community appreciates you too. Thank you.
Right. So join us in 2 weeks. NAOPO and PBD, thank you for joining us this evening. Have a great evening.
Thank you, guys.
Thank you. Take care.
Thank you so much.